In order to try to separate yourself sometimes from the stress and the worry about taking care of patients, it's good to try something that's completely different. And so I like going flying for that reason. When you've taken off, you're in the moment and just doing your job then. It's the same as in surgery when you've made that incision and you're on your way. My name is Dr. Randall. I'm a pediatric orthopedic surgeon here at Marshfield Children's. I help kids who have injuries to their bones or joints, kids with trauma, kids with deformities, kids with limb length inequalities or limb length differences. I help kids who have congenital deformities and who have acquired deformities after trauma. A great day is when we've made a difference in someone's life and helped somebody. And sometimes that's not apparent right away, but we see later that they do really well. We have a lot of things that are definitely instant gratification, like putting a broken bone back together with a plate and screws is instant gratification. You have made a difference immediately for somebody and made them better off. Sometimes it's more subtle and it's more delayed gratification, and limb lengthening is a good example of that. There can be lots of reasons why limb lengthening can be a good option for a patient. If a patient has an acquired problem, like for example they had trauma that affected the growth plates of one of their long bones, sometimes kids with cerebral palsy that affects half of their body more than the other half, sometimes people are born with a congenital difference from one side to the other. There can be lots of different reasons why the inequality exists, and limb lengthening can be one way to help solve that problem. We're surrounded by subspecialists in every area that we need to help these kids. So if a child has a complex problem that requires pediatric endocrinology or pediatric rheumatology, those specialists are available here. So I consult with them regularly and we share a lot of mutual patients. I like to try to give each patient what they need. So that means that for different kids, even who have the same problem, the treatment isn't always exactly the same. We try to let parents know why we're choosing a certain treatment option and use shared decision making to make sure that everyone's on board with the particular treatment that's chosen for that problem. I do try to explore every non-operative alternative we possibly can before deciding on a surgery. I think that's my job as a surgeon. I mean, surgery is difficult for kids and for adults. You're making yourself really vulnerable when you're signing up to let somebody put you to sleep and do surgery on you. And so it's an incredible amount of trust that patients put in us, and we take that very seriously. I've gotten some really adorable thank yous from patients, and it really means a lot to me. It makes it all worthwhile. I've had a few really happy moments since starting to practice here at Marshfield Children's. When I see a patient who does well after surgery, or even better than they expect to, that's the best possible outcome. Kids are really good healers, is the reason for that. Kids tend to be really positive. They want to get back to playing outside and doing the things that they love doing. There are a lot of similarities between flying and orthopedic surgery especially. The feeling that you have when you're preparing for a difficult case, looking at the anatomy, mapping things out, making decisions about what you're going to do first and then second and then third, that's really similar to making a flight plan before you go flying on a long cross-country trip. You have to look at the weather, you have to look at the terrain, make decisions about what your waypoints are going to be. It's very, very similar in a lot of the same mindsets that go on. Checklists are really important in flying and in surgery. They help you to standardize a procedure so it's the same every time, or as similar as possible every time, and that makes it way less likely for human errors to get into the way. I'm always thinking in my mind about the things that can go wrong, and so that might sound really negative, but that helps me prevent those things from happening and makes it more likely to have a good outcome. I love a lot of things about my job. Helping kids is especially rewarding. You get to see them make their progress through their healing and then enjoy the work that you've helped them with for years to come.